Good evening, sir. Good evening, all. My name is Dillibabu. My topic is a comparative study on the effect of asana practice and dynamic exercise on tongue flexibility among adults. Next slide. Uh, this is a structure map, uh, methodology, fun, conduction covers theoretical models of flexibility, history of yoga paths, physiological mechanism models and extensive lecture meta-analysis and methodologies detail of 6-week parallel experimental workflow and 60 participant design guidelines, 6 COSAT design safety boundaries, 30 members static asana and 30 members dynamic exercise and uh, pre-post the spine and core axis, posture integrity dependent on the coordinated biomechanical dynamic of the spine column, pelvis, and stability posture, muscular chain, and functional aging systematically restore loss, joint range of motion, and mitigating age-related structural tightening and myofascial fitness. Connective chain actively stretches deep facial illness, facial line to support safe lateral forward and backward rotation extension vector. Flexibility categories, static range, static means asanas, the main static position, and dynamics, moving exercise. Next,
Please
fourth
explain
chain.
about the methodology and that results.
Oh, uh, static range on the passive flexural ability to hold safe, a safe structured position at structure limit point comfortably. This is static range means asanas, mainly focus on the static position asanas and dynamic range, active musculoskeletal movement pathways through full structural joint range of motion velocities. It's a dynamic exercise. Next, postal chain. Postal chain benefits, vectoral alignment, safeguard physiological spine curves, and eliminates cystic compensation in textural patterns, movement effectiveness, efficiency, optimize fundamental daily tasks like reaching, twisting, bending, and lifting, lumbar protection, directly minimize collective comparison stress on the vertebra, lowering of risk of disc pathologies, and semi motor control re-educates spatial awareness as engaging posture balance and systematic stability. stability. Intervention method. These are the intervention method. Occupational arousal, secondary workflows, excessive sitting, driving, and poor laptop posture lead to server armstring shortening, pelvic rotation block, and premature lumbar stiffness in adult age category 40 to 50 age categories. Structured value, age later range loss can be effectively checked within the systematic intervention. Next. So next. Uh, Modern mind body health, CNS integration integrates consciousness controlled breathing patterns with static joint angles, down regulated systematic stress, and muscular gardening. இது வந்து ஸ்டாட்டிக் பொசிஷனுக்கு rehabilitative focus widely adopted within standard clinical physical therapy programs for correcting chronic structural issues and lower back pain cycles. Next, these are the asanas: Trigonasana, Sedumandasana, Supta Manjasana, Bhujangasana, Paschimottanasana, Adha Svanasana, Salabhasana. These are all asanas for static position, Yogasana postures. Next slide, sir. These exercises are dynamic exercise. Standing torso rotation, standing forward bench, seated twist, dynamic leg swing. These are dynamic exercise. Next, sir. Uh, Range of motion pillars. These are the range of motion pillars. Range of motion means do exercise means if raise hand means it is a range of motion. It's a problem means flexibility is more important for range of motion. Joint mechanism, the clean sliding and rotational kinematics of skeletal articulation, joint capsules and supporting deep ligaments, and myofascial plasticity, the intrinsic physical ability to skeletal muscle fiber and surrounding connective layers to shape, adapt and lengthen. Neu- Neuromuscular is the progressive structural desensitization of spinal stretch, reflex, reducing reactive against spasms. Stay. Aim and research object means primary investigation aim, the systematically run and experimental investigation covering the specific. Uh, the study conclusions, key research takeaway, both physical modalities significantly improve the lower back range of motion. However, static breath regulate yogic asanas are comparatively more effective and enhancing static pelvic and spinal flexibility pattern in adults age 40 to 50 than dynamic repetitive drills. Practical applications, we recommend fitness instruction and physical therapies, integrated progressive static safely held yoga posture to common age-related musculoskeletal spine stiffness, developing dynamic exercise as active warming sequence prior to introducing chatting holds. இப்போ ரெண்டுத்துல பண்ணும்போது ஸ்டாட்டிக் ஆசனாஸ் வந்து மோர் ஃபிளெக்சிபிலிட்டி தந்திருக்கு கம்பேர்ட்லி வந்து டைனமிக் எக்ஸசைஸ். ஸோ ஃபியூச்சர்ல வந்து ரொம்ப ஆசனா ஃபிளெக்சிபிள் வேணும்னா ஸ்டாட்டிக் ஆசனாஸ் பண்ணும்போது மோர் ஃபிளெக்சிபிலிட்டா இருக்கும். ஃபிளெக்சிபிலிட்டி எதெல்லாம் முக்கியம்னா நிறைய ஸ்பைன் எதுக்கு முக்கியம்னா ஃப்ராக்சர் ஆகாம பேக் பெயின் இதெல்லாம் வராம இருக்கிறதுக்கு ரொம்ப முக்கியம். ஏன்னா ஃபியூச்சர்ல நிறைய பேர் வந்து பிசிக்கல் ஆக்டிவிட்டிஸ் பண்றது இல்லை. ஸோ அதனால ஃபிளெக்சிபிலிட்டி கம்மியாகும். எக்ஸசைஸ் பண்ண பண்ண ஐ மீன் ஆசனாஸ் ஆர் எக்ஸசைஸ் பண்ண பண்ண ஃபிளெக்சிபிலிட்டி இருக்கும். நோ எக்ஸசைஸ் மீன்ஸ் நோ ஃபிளெக்சிபிலிட்டி. இட்ஸ் ப்ராப்ளம் ஃபார் எவ்ரி ஒன். தேங்க்யூ சார். தேங்க்யூ மேம். தேங்க்யூ வெல்ஸ். தேங்க் மனுஷ்.